Welcome back. When it comes to your hard diet and exercise, anything is better than nothing, and much of cardiovascular disease is preventable. Dr. Michael Liston from St. Mary's Medical Center is here with a guide for your personal cardiovascular health. So what are some of the best steps that we can do to have a healthy heart?
Well, good morning. I'm glad you asked. I think the first step in assuring heart health is that a person has to know what their cardiovascular risk factors are. And a lot of us go through our daily activities and don't even give it a thought. But the risk factors are pretty simple. There's hypertension, diabetes, high cholesterol, smoking, and then there's some non-modifiable risk factors like family history and female or male sex, which can't be changed. But I think most importantly, you have to identify what your modifiable risk factors are and then approach those things with a peace of mind.
Okay, and then when we talk about the causes of cardiovascular disease, what are those?
So again, going back to the modifiable risk factors, we have hypertension, diabetes, high cholesterol, smoking. These are all risk factors that contribute to the development of atherosclerosis or hardening of the arteries, which can affect our carotid arteries, our heart, our peripheral vasculature, which can lead to things like heart attacks or strokes. So if you look at what are the causes, it's a myriad of things that cause coronary artery disease. And my point today would be very simply, you need to, as an individual, identify which of those risk factors are affecting you and then take steps to improve those.
Okay, and you mentioned stroke and heart attack. Of course, for a lot of people, that would be the worst case scenario. So what would be some of those preemptive signs that we'd look for?
Sure. So the end result of coronary artery disease or atherosclerosis, it would be a stroke or a heart attack. And I think what I like to focus on most is prevention as opposed to treatment. So an ounce of prevention is worth a pound of treatment. But if you've gone along far enough in the disease process, then you can have a stroke or a heart attack. So the signs of a heart attack vary quite a bit. Typically, we think about substernal chest pain radiating to maybe both shoulders or your jaw. You get sweaty, you have shortness of breath. These might be signs of an oncoming heart attack. Oftentimes these symptoms start with activity. Maybe you're shoveling your driveway in the snow, or you're walking up a flight of stairs and you start to have chest pressure. This could be early warning signs of a heart attack. A stroke also, which is something that affects our cerebral vasculature, would have drooping of the face, difficulty talking, maybe your arm gets weak or your leg gets weak. So these are signs that you need to be aware of. But of course, what we'd like to see is prevention before treatment.
Absolutely, and that's what's so great about all these educational segments. It really puts us in charge of our own health. Now, what are some of those barriers to achieving our best ever heart health?
So sure, so the primary reason for me to be here is to address what the barrier is to us all getting healthier in our heart. And the biggest barrier is understanding, education. When I talk with my patients, I'm overwhelmed by how much they don't think about heart health, and it's not their fault. I've grown up in cardiology for many years, and so I think about it all the time. And what I realize is that it's a simple thing to think about, but people just don't see it. So I constantly talk to them about prevention, about identifying their risk factors, getting a good idea, are they at risk for a heart attack? Certain people are low risk, certain people are intermediate risk, certain people are high risk. And if you can identify where you fit on that spectrum, you might be a little more proactive in taking care of your heart health.
Well, thank you so much, because those are all such important things to consider, and hopefully we could take some of those preventative measures. That way we'd be more in the low risk area. So St. Mary's Medical Center offers a monthly Doc Talk on the third Tuesday of every month, which is tonight. The topic is heart health for February. It's from 6 to 8 tonight at St. Mary's Medical Center in Blue Springs. For more information, just call 816-228-5900 or go online to stmaryscasey.com.